Enfold Proactive Health Trust, Creating Safe Spaces, presents Demystifying Sexuality, a video series. What are some common issues in reproductive health? How can one manage them? Part 1, presented by Dr. Shoiba Saldana, co-founder, Enfold Proactive Health Trust, obstetrician and gynecologist.
Hi, I'm Dr. Shoiba Saldana. I'm a gynecologist practicing the last 32 years. And I also work in the area of sexuality education and prevention of child sexual abuse and sexual violence. Today, we're going to be discussing about menstrual cycles or periods. Now, I know this is something which troubles most women, and it has become more and more confusing of late because of a lot of different issues. So let's look at when do periods start. Now, on an average, women's periods start between 9 and 16 years of age, with an average of about 12, 13, 14. However, nowadays we're finding that some girls may start their periods even as early as 8. Now, having the period means basically that you are now able to have a baby. The secondary sexual characteristics like the hair under the arms in the pubic area, the smell of the body, and the associated changes of puberty, for example, the body smell and acne, all these start developing. Then the breasts start coming up. In girls, particularly, they also start having a white discharge about 1 or 2 years before they're going to have their periods. And finally, the periods start. This is considered a natural process. At the other end of the spectrum, when women's periods stop, it's around the age of 47 is the average for Indian women. But it can be as early as 40, 42, and it could be as late as 55 to 60 years of age too. Sometimes women who have stopped their periods at about 30, 35, we consider that as a premature ovarian failure. But usually this is familial. So most of them have mentioned that their mother or grandmother also stopped her periods at around 30 to 32 years of age. So you do get a warning for that. And sometimes when your periods start, you may have one period and may not have a period for about 6 months to 1 year. And then pretty much after that, there is a normal cycle. Now, when we mean a normal cycle, it's separate for each woman. So anywhere between 22 days and 45 days is an okay cycle, provided it's the same cycle for a person. Also, when there are stressors which change the period cycle, so if you're traveling a lot, if you've got exams, if you've had heavy antibiotics or painkillers because of a surgery or because of some severe ill health, it can affect your period. In fact, a lot of girls get worried when during exams they miss a period and they panic about it and unnecessarily take hormone tablets to get their periods when there's no such need whatsoever. It's better to just wait and watch. Now, what are the reasons why the cycles are getting so irregular? One is lifestyle. And I would probably say the education system is one of the biggest causes of irregular periods. What do I mean by that? During the time of puberty or the teenage time is when a person's body is changing. And the most important things are nutrition, good sleep, which is about 8 to 9 hours in a teenager, lot of sunlight, lot of open air, lot of physical activity. And unfortunately, from the time of your class 8, 9, 10, 11, 12, the first thing that happens is your physical activity cuts down. You're not allowed to go out in sunlight. You're studying all the time. You're stuck with books in a sitting position. You also end up having to get up at 5 o'clock in the morning to attend tuitions and classes, study for 8 hours a day in school, again come back for more tuitions, more homework. So you're sleeping much less. This results in irregular cycles. And sometimes these are denoted as, a doctors diagnose this as PCOD, which is an absolutely wrong diagnosis. This is a temporary irregular cycles created by a very, very unhealthy lifestyle. If more and more young people were allowed to dance, play, run, walk out on the streets in sunlight, have a lot of sunlight, sleep for 8 to 9 hours, a lot of these irregular cycle problems would not arise. The other issues is, of course, the chemicals in our food. We have a lot of pesticides, we have chemicals in the water, we have a lot of vegetables and fruits which are grown with artificial um, uh, chemicals which help them to ripen off the tree. And so these also are affecting our entire system, with the result that there are some girls who may have periods every 1.5, 2 months, 3 months, maybe 4 to 5 cycles in a year. However, If the cycles are coming by themselves, that means the girl is not taking any medicines to get them, and her cycles are the same which she normally has. She may have a 7-day cycle, 5-day periods, she may have just 3 or 4 days of bleeding. It works fine. That means her body is ovulating and the cycles are coming even though they are irregular. Polycystic ovarian disease or polycystic ovarian syndrome is a pathology where a girl has irregular menstruation. She has periods which are very delayed. There is less bleeding, so sometimes spotting continuously for maybe 10, 15 days. Along with that, she often has excessive facial hair, like in the mustache area and the beard area. She has hair on the front of her chest and her abdominal wall. Plus, she has acne, as well as she has to have abnormal hormone levels where the FSH and LH ratio is 1 is to 3. The ultrasound diagnosis shows that she has large enlarged ovaries, which are more volume, plus they have at least more than 10 follicles immediately after the cycle. All these together will cause a polycystic ovarian disease. However, I sometimes find that a girl will go because of excessive facial hair or acne, but her periods are absolutely normal and she will be diagnosed as PCO. Now, this is often misdiagnosed, and children are scared, and parents are also told that she will have problems having a baby later. PCO is also associated with a metabolic syndrome and the issues of breast cancer and other cancers later. So, all these things create a fear in the mind of the child and the parents. Around 10% of couples will require some help in getting pregnant. And we consider that a couple is infertile and requires some sort of medical intervention if they have been having unprotected sex for 1 whole year and they have still not got pregnant. And there's nothing wrong with you if it takes 1 year to become pregnant. Very often, young people go to the hospital in a hurry for checkups because of pressure from the family and end up doing a lot of medical intervention, which is not necessary. Nowadays, very, very sensibly, young couples, when they get married, would like to wait for 2 to 3 years before they try for a family. And I think that's amazing because the first year of married life can be quite rocky. It takes about 2 to 3 years for a husband and wife, whether it's a love marriage or an arranged marriage, to get into sync with each other in a comfortable relationship. And that's the best time to have a baby. There are some couples who married much earlier who waited almost 7 to 10 years before they planned and decided on having a baby, and they've had no problem getting pregnant or having a child. Earlier, we used to consider that the age of 30 was some sort of a benchmark that you had to have your first baby before 30. And now we know that's not true. A lot of educated working couples get married between 28, 32, 34. They would definitely wait 2, 3 years before they have a baby. And a lot of women now come for their first babies at 34, 35, 36, even 38 and 40. And they're able to have babies, perfectly healthy babies, normal babies. The important thing is to know that it's the health of a person, the health of the woman and the man, which is important in terms of having a baby, not the age. Among men also, when men have a healthy lifestyle, they exercise well, they are fit, they don't smoke, they have a regular lifestyle, sleeping at night and staying awake in the daytime. These are things which also help in terms of a health of a male. When infertility issues come up, we normally always examine and investigate the woman. But actually, it's been found 40% of the time there is a problem with the man, 40% of the times there's a problem in the woman, and 40%, 30% of the time there's a little problem with both the man and the woman. And most of these things can be corrected with a certain amount of help. It's also important to wait patiently through the process of medical intervention. It doesn't make sense to try for 1 or 2 months and out of sheer desperation jump into IVF or excessive hormonal medication and treatment rather than investigating what's important. The basic investigations we do for a young couple who's coming for a baby is the semen test in the man and his general health, like his high blood pressure, if he has diabetes, thyroid, and his health indicators. In a woman, we would look at her cyclicity of her periods. We would look at the amount of bleeding she has, whether she has fibroids in the uterus, whether she has ovarian cysts. We would also look at her thyroid, her blood sugar, and her diabetes. We also do additionally a tube test, which is to check that her tubes are clear. Within these basic tests, pretty much 9 out of 10 couples will be able to become pregnant if these are treated and checked out. Male condoms are distributed widely and are available in both primary health centers as well as in medical shops. However, the female condom, which is widely used both in Europe and the US, is not available in India easily, not by the government systems, and therefore they're very costly. Like they cost around 250 rupees for one female condom. The intrauterine contraceptive device, which is like a copper T or a loop which is kept inside the uterus, this has to be put in by a doctor or a nurse, and it stays for 3 to 5 years. Normally, with the copper T, a woman may have a little bit of cramping or little heavier bleeding, but almost 50% of women adjust very easily and comfortably to it, and it can be used both as a contraceptive for a woman who's never had babies or to space children, where a couple may have had one baby and they're not sure whether they want to go for the second or they want to wait 4 to 5 years before the next baby. There are many hormonal tablets which affect pregnancy, and these are the first one is what is known as a oral contraceptive pill. These are sets of 21 to 28 tablets which are given on an everyday basis. A woman has to take them, she can take them for 1 month, 3 months, 7 months, 1 year, 2 years, 5 years. And the oral contraceptive pill is something which regulates a cycle and prevents pregnancy. Now, because the ovulation is avoided with oral contraceptive pills, her chance of getting pregnant are very, very low. However, it is a hormonal tablet, and some women may have migraines, they can have pain in the breasts, they could have increase in depression and heaviness in the body. Though where they do say there may be increase in weight, it's not normally seen with the newer contraceptives. It is best for women over 30 to avoid using contraceptive pills because of an increased risk later on, a relative risk of breast cancer. However, it must be admitted that women who have used oral contraceptive pills have a lesser risk of dying of breast cancer than women who have never used oral contraceptive pills, for the simple reason that they will take more effort to ensure that they do a breast examinations and check out their health, rather than women who may be unknowing of it and ignorant of the risks of breast cancer just because they've never taken any hormonal tablets. Those are called oral contraceptive pills. Another one is called the emergency contraceptive. What does that mean? Emergency contraceptive means it's an emergency. That means you were using condoms, the condom broke, or you got drunk and you ended up having sex without using condoms, or after having sex, when pulling out, the condom slipped and there may have been a spillage. So you're worried about getting pregnant. The emergency contraceptive pill is a strong dose of progesterone which alters the lining of the uterus and hopes to avoid ovulation or prevent an ovulated egg from getting implanted in the uterus. It has a 40% failure rate and a 60% success rate. So, as an emergency, it's useful. It's 60% it can prevent a pregnancy from happening, but it's not a good regular pill to use. And it is advisable to not use a contraceptive, emergency contraceptive, more than once in 3 to 4 months to ensure that your period cycles don't get awry. And finally, the best contraceptive is for women and men, which is called the permanent sterilization, which could be the tubectomy in women and the vasectomy in men. If you have completed your family, not planning to have children at all, then having a permanent sterilization or a permanent family planning operation really reduces your risk of getting an unwanted pregnancy later on in life. One of the issues which women face is if they have been sexually active and they're not very sure that the contraceptive has worked or not, they may end up with a delay in periods. Now, the point is, if your periods are delayed just because of an eye pill or just because of your anxiety, they will come anyway. On the other hand, if you're pregnant, taking tablets to get your periods is not a good idea. It's better to check whether you're pregnant, take the test, and then you have to take a different set of pills to have a termination of pregnancy or an abortion pill, rather than taking the regular tablets which are given, hormonal tablets which are given to get your cycles. It's not a good idea to take hormonal pills to regularize the cycle just every time your periods get delayed, because it messes with your cycle. It's more important to understand, watch your cycles for a year, see what is delaying them. Is it your lifestyle? Is it bad sleeping habits? Is it excessive nutrition? It is poor nutrition. maybe a heavy amount of drinking or smoking, which is altering your hypothalamic pituitary axis, and that is causing your cycles to change. Adding hormonal tablets onto an already hormonally imbalanced body is a bad idea. Let's look at the topic of abortions. An abortion basically means that a woman is pregnant when she doesn't want to have the baby, and she would therefore like to go for a termination. India has one of the most liberal abortion laws, the MTP Act of 1971, which allows any woman over the age of 18 to give her own consent and go for a termination as long as her pregnancy is less than 20 weeks of gestation. That means if a woman is over 18, she's pregnant, she doesn't want the baby, she can go to any government hospital or any private practitioner and can ask for an abortion. And after the preliminary test, that is an ultrasound, hemoglobin, blood group, the woman can have the abortion. If a girl is under 18 years of age, she can have the abortion with the consent of her guardian. Unfortunately, due to the POXO Act, if a girl under 18 becomes pregnant, it is presumed that it is a sexual assault, and therefore, under the POXO Act, a case has to be filed, but she can still continue with the medical termination of pregnancy, and that cannot be refused by any doctor. The doctor has to file a medical legal report, but has to do the termination of pregnancy. However, products of conception have to be kept because they will be used as evidence against the accused. In terms of abortions, up to 8 weeks of pregnancy, a woman simply has to take what is known as the abortion pill, the MTP pill. This contains RU486 or mifepristone. This is a tablet which works against the pregnancy hormones. Some women go to pharmacies and take the tablets themselves, and that's not a good idea because out of 100 women, if the tablets are not taken well, almost 5 to 10% may have very heavy bleeding, which may need some amount of medical intervention, or the pregnancy may not get terminated and may continue. And so, always we ask for a patient to have a scan, ultrasound, to be done 2 weeks after the tablets are taken to confirm that everything is cleared. The basic premise of having an abortion is one, the mother's health or the woman's health should not be affected. And secondly, in the future, if she would like to have a baby, that is also not affected. And therefore, a certain amount of precautions are taken to ensure she has a safe and legal abortion. When the pregnancy goes further, she will have to get admitted because the pain and the bleeding could be a little more. And then she has to take the same tablets in the hospital. And it's possible to use tablets to have a complete termination of pregnancy up to the age of 20 weeks. We also know of pregnancies over 20 weeks where the child is extremely abnormal, or the child may have died inside, or there may be other health issues where the mother has severe renal failure or very high blood pressure, where it is essential for her health to terminate the pregnancy. And there the termination can be done at any age because the mother's life takes priority over the baby's life. One of the areas in India where we fail is to give emotional support to the girl who's undergone a termination of pregnancy. Usually, if she's unmarried or she's recently married or she already has children and she's not ready for the pregnancy, she gets a deep sense of relief after the termination. However, along with that, because of the socio-cultural nature, that a pregnancy is something which should be kept, that abortion is something which should not be done, a woman also gets a sense of guilt and shame, which is why when you speak to your families, most people will never tell you if they've had a termination of pregnancy because they feel it's something to be ashamed or guilty about, even if they've had it within a marriage relationship. So the psychological impact for women, sometimes they get scared that they may not be able to have a baby later. And if a abortion is done properly with proper medical care, there is no problems about having a baby later. And it's very, very important that the partner is extremely supportive and caring, understanding that it's not just the removal of the pregnancy, but the emotional impact on the woman which needs support.
This video is part of a series of videos and learning content aimed at addressing gender-based violence. These videos provide practitioner perspectives by professionals and experts in the field. We hope these videos generate further discussions with peers, family members, and teachers, encourage curiosity, and seed further research ideas in these domains. We gratefully acknowledge the following for their support: Gaurav Krishna, Keshav Rajendran, Ishwar Shankar, Mohan Ram. Clockwork Captions, Enfold Consultants, Ford Foundation. The copyright and other intellectual property rights in respect of this video belong exclusively to Enfold Proactive Health Trust, Enfold. Enfold licenses this video under the terms of Creative Commons License CC BY-NC-ND 4.0, the details of which can be found at https://creativecommonslicense.org/licenses/by-nc-nd/4.0/. Any use or reproduction of this video contrary to or in violation of the terms of the aforesaid Creative Commons license will be illegal, and Enfold reserves the right to take suitable action in respect thereof. Enfold also reserves the right to modify, terminate or revoke the license granted as aforesaid, or otherwise exercise any and all rights in respect of its intellectual property without further notice, and the same shall be binding on the licensee or user or reader thereof. June 2021. Enfold Proactive Health Trust. www.enfoldindia.org. Contact info@enfoldindia.org +91 99 000 94251 www.enfoldindia.org.